All right, everyone, welcome back. We are on part 2 now, GI drugs. We left off on slide 48. First off, we're going to talk about the prokinetic drugs. So pro just means in favor of, kinetic or kinesis means movement. So these are drugs that will help the movement of the GI tract. We have two drugs here to talk about. First one is metoclopramide. Notice the mechanism of action here. Has a few different things going on. So this one actually has three neurotransmitters you need to worry about. It first augments the release of acetylcholine. So that plays a part in its role in enhancing gastric motility. It also, and this is at higher doses, will block dopamine, so D2 blocker, and serotonin receptor. So and this is where you get the antiemetic action. So notice it has a few different things that it's used for. The reason we're talking about it right now is because of, well, these are all GI related, but specifically it's prokinetic, so gastroparesis, it's effective for that. But it can also be used for GERD, usually not first line for GERD because there are more effective treatments out there. Like I mentioned, the proton pump inhibitors are very effective, those. And then nausea, vomiting, it can be effective as an antiemetic, so helps prevent emesis, which is vomiting, so can be used for that. Also not usually first line antiemetic for nausea and vomiting, but it can be there. Some of that is related to its adverse effects. You'll notice there are some movement disorders, some extrapyramidal or dystonic reactions, and then there is a boxed warning for another movement disorder, tardive dyskinesia. So that's what they typically recommend, that you do not treat for more than 12 weeks. Another reason that this is another reason, rather, that this medication is on the Beers criteria. So this one you should please note here to use with caution in your elderly population. Excuse me. So geriatric population, you need to be careful with this, and definitely would not be first line for GERD or nausea and vomiting for a geriatric person. So please make sure you note that. And then we have Cisapride, which now it's only available via a special protocol, limited access. So you have to go through the company, Janssen's the pharmaceutical company. You have to go through the company, register, its paperwork and all this stuff. So this is one that I'm not sure if you guys are going to be coming across, or I honestly have never filled it personally as a pharmacist, but, so it'll just kind of depend. I'm assuming this is just, if you're working with a specialist, maybe, then this is something you'll see, but just your run of the mill because of its limited access, I don't know. Yeah, who knows if you'll see it or not. But anyways, mechanism of action, it basically, again, involves acetylcholine, so it enhances acetylcholine. And then it is also a serotonin agonist. So go ahead and read through those. But those all are prokinetic. Those both have prokinetic effects, and they accelerate gastric emptying. So the uses here, go ahead and read through these uses. But again, this is going to be something that's going to be under the, usually with a specialist. And a big reason here is go ahead and put a star here. A reason why it's limited and how you have a special protocol and its limited distribution is because of the box warning. Unfortunately, it can, cause fatalities. So serious cardiac arrhythmias have been reported with patients taking this medication. So that is something that, is problematic with this drug. Also notice too, it can negatively affect the liver, increase liver function test, and also has some negative hematologic effects. So read through all of those, which should also be pretty nasty. And then GI adverse effects here as well, which is more common. But so because of these adverse effects and because of this box warning, the Cisapride is limited, and again, is going to be something that you'll have to go through some special paperwork to get. Next, we're going to antiemetic. So those are prokinetic there. So now these are antiemetic. Again, like I said, emesis means vomiting. So these help reduce nausea and vomiting. Unfortunately, the physiology, basically what's going on with emesis isn't completely understood process. Here's kind of the best guess and what we, best scientific guess as far as what we know. Is taking place. So again, it's not fully elucidated. It's like some of those mechanisms of action. So we don't know exactly what's going on, but we're going to try to hit it with some different mechanism of actions. First one we have, a very popular one, is the serotonin. So 5-HT subtype 3. So 5-HT3, so serotonin 3 antagonist. So it's a serotonin blocker. We have the list here. Safe and effective antiemetics. I put a little asterisk there. So all of these are safe and effective except for this first one right here. These are all classified the same, but for prescribing purposes and for testing purposes, please go ahead and separate this one out. Allosterone, we'll have some slides coming up, but it's a lot more dangerous and it's not as safe as the other ones are. So just go ahead and put a little asterisk there, whatever. Just make sure you note that that one is a little bit different. But for categorization purposes, we will go ahead and categorize these all together. Uses, so these again are very effective. They're all very effective, even though this allosterone is not as safe. They all are very effective at treating emesis. So you see them used a lot, both inpatient, outpatient, chemotherapy-induced, post-surgery, hyperemesis, so yeah, lots of uses there. Allosterone, like I said, it's a little bit different. It can be used for IBS. However, it should not be used first line. And so you notice here, patients who have not responded adequately to conventional therapy. So IBS, but again, not first line. And the reason why is because of its box warning. So this is the reason why it's not as safe as the other serotonin blockers that we had listed there. And so serious GI adverse reactions. So definitely read through this, and this kind of touches upon the IBS and stuff too, but box warning. And then this is why the allosterone is not as safe. But the other ones there are all, safe and effective. And then one other note too. So ondansetron, this is generic Zofran. You hear that one. That one's very popular. So this one, you don't have to necessarily put a star by it or anything, but just know that this one is generic Zofran. And that's just, you see that one prescribed a lot, and it's very, very popular. It's ubiquitous. Next, we have the cannabinoid derivatives. So just legalize it. No, I'm kidding. So we have dronabinol and nabilone. So these both work on the endogenous cannabinoid receptors that we all have in our bodies, and it is also part of the reason why the medicinal marijuana is popular for antiemetic properties. But these are basically synthetic derivatives of cannabis, or the cannabinoids, and they help with nausea and vomiting. So you'll see they are controlled substances. You guys can prescribe them. They're not C2s, but typically they're reserved for patients who have cancer. So chemotherapy-induced nausea, vomiting, and then maybe someone who has AIDS. Adverse effects there, just common, not super serious adverse effects, but we have some adverse effects we have to be concerned with here. And then, like I said, this is a big reason why the medicinal marijuana. But I won't get into the politics or whatever of that. But yeah, so some patients prefer that or whatever. And depending on what state you end up practicing in, if you go to Colorado or California, whatever the ones have, some states have medicinal marijuana that can be prescribed for nausea, vomiting, and some states even have it for recreational use. Go figure. But Texas, for now, we do not. So don't prescribe it for your patients. All right, next up we have the dopamine, and it's D2 receptor antagonist. You'll notice that the metoclopramide is there again. Okay, so the students don't like this, and it frustrates them. And I'm sorry, please don't be mad at me. I didn't write the book, no, but it is classified as both the prokinetic medication, and it is also a dopamine D2 receptor antagonist. So apologies if that makes your studying a little bit more complicated, but just please go ahead and have it in both places for testing purposes. And I touched about, when we talked about metoclopramide already, we talked about its dopamine antagonism as part of its mechanism of action. So hopefully not too much of a surprise. And it's really at the higher doses where it has more of its dopamine antagonism. So anyways, so yeah, here we have the list of the dopamine 2 receptor antagonists. The phenothiazines, just a quick note on there, it's promethazine is there. That's a popular antiemetic, a lot of prescription medications. We'll be talking about these more in detail in the psych module, so you will be seeing those again. And then also note that the trimethobenzamide is similar antiemetic properties to metoclopramide, so just refer back to that, to metoclopramide. It is a similar action, and here's a specific mechanism of action for that medication. But yeah, and again, it's not fully elucidated, but you can think of it as kind of being like metoclopramide. Phenothiazines, like I said, this is the one that includes promethazine. That's a really popular medication to be prescribed, and then unfortunately to be abused as well. But multiple uses, so go ahead and look at these, and I want to make sure you guys know all of the uses for these medications. Antihistamines, so again, I know we've been over antihistamines a few times now. We've talked about the H1 blockers, before, and we talked about the H2 blockers in this module earlier. So we're going back to the H1 blockers. This is what these antihistamines are. And these are first generation antihistamines, which hopefully you guys will remember from previous lectures. And, so everything stands what I've said before about them, as far as adverse effects, etc. So adverse effects, hint, they, cause nausea, drowsiness, and dizziness, but they are used and they can be effective for helping reduce nausea and vomiting, and specifically can help with motion sickness. So I don't know if you guys remember, there was we had tested on this stuff before, but so want to make sure you guys just think of these again in another light. Think about them for the GI module as well. But yeah, we've already talked about these a couple of times, so this would just be kind of a review. And I have the Cyclazine here. It was discontinued last year or about a year or so ago in the US, but it's here just for historical purposes. And then two, just I was told that the PANCE exams, I'm sorry, your board exams, not the PANCE, your board exams, yeah, that's the PANCE exam. I'm sorry. It's PANCE and then PANRE is the other. Okay. So for the board exam, it is sometimes a little out of date, and they will have some older stuff on there, and it's like, it's not, they have sometimes materials, it's 3 years old or whatever on it. So anyways, just there for historical purposes. Anticholinergic drugs, again, one that I believe has been in previous presentations, but just for completeness sake, this is an anticholinergic medication, scopolamine. They do have transdermal. They make patches that you can get over the counter that can help with motion sickness and help with nausea, vomiting. They had the injection for up until recently. Again, that was recently discontinued, so just don't worry too much about that. It's just for historical context. And then ophthalmic, which we will talk about more in ENT module, but this could be, if you're with an ophthalmologist maybe, or you might be seeing that. But that's kind of, so transdermal is probably what most people will come across in your prescribing lifetime. Next, we have the NK1 receptor, so neurokinin receptor antagonist. A couple ones there. So this is a little confusing for students sometimes, but hopefully it won't be too bad this time. So we have aprepitant and fosaprepitant, which sound very similar. They have 3 letters in difference, but aprepitant is an oral medication. It comes in a capsule and an oral suspension, which is just a liquid. And then fosaprepitant is a prodrug. So this is just, it's IV aprepitant, right? So this is, again, very similar, and you'll see that IV or whatever, but it just basically depends on how you're administering it, which drug you order. So anyways, so this helps with nausea and vomiting, especially see it with chemotherapy, especially in combination with other antiemetics. And then you'll see it with surgeries too. So it helps with the post-op nausea and vomiting. Good summary table as usual. Please look through that and make sure you read through that. Drugs used to treat IBS. So we have IBS drugs here. We have the tricyclic antidepressants, which we will talk about more in detail in the psych module, but just please note that a couple of those, specifically amitriptyline or desimoprime, can be used to help with the pain associated with IBS. And then there's antispasmodics. So for example, we have some anticholinergics, dicyclamine or hyoscyamine, that can also help with the symptoms of IBS. So we have those up here on top in these 2 black boxes. So please go ahead and read through those and make sure you pay attention to those. And then we have, let's see, a couple other medications that can be used to treat IBS. First off, we have the selective serotonin H, so it's serotonin subtype 4. It's a partial agonist, so Cisapride. And this one is interesting because it's, again, limited availability. It's only available via FDA Emergency Access Protocol. So for emergency treatment, go ahead and read through that. And it's not, first line and everything. So that's something that's going to be a little bit harder to prescribe. And again, probably with a specialist that'll be doing that if you're working with specialists. And then we also have the serotonin H3 receptor antagonist, which we talked about already, allosterone. And that's the one that, please refer back to those previous slides. It has a box warning, etc. It's not first line treatment, but it can be used for IBS as well. And we have those down here in the bottom half of this table. This table, kind of debated whether I should leave it in or not. So students always freak out and they want to know if I need to memorize it or not. So I left it in because it can maybe help some people for studying purposes, but it has the receptor subtypes of serotonin that can help you with studying, but don't stress too much about the distribution in second messenger. These two columns here, I won't ask you to memorize this and reproduce it, etc. But you'll notice there are drugs here that we talk about and there are uses here that we talk about. So I can't say don't worry about these. Some of these drugs we haven't seen yet, like clozapine we haven't seen yet, olanzapine, risperidone, we haven't seen those yet. So there's some we haven't seen on here. Don't stress too much about it. But if this helps you study, fine, use it. But if it doesn't, don't worry about it. It's not. I'm not going to say that it's not testable material because, like I said, I mean, we talked about ondansetron. It involves HT3, subtype 3 receptor as far as it's an antagonist of that receptor. So just, kind of look through this and pick out the ones that are relevant to this GI module and, go and look at those. We already talked about buspirone before, but anyways. IBD. So here are some drugs that are used to treat both CD, which is Crohn's disease, and UC, ulcerative colitis, which we'll be learning a lot more about in pathophysiology and ICM. But the drugs we have first off, the salicylates, list of them here, all chemically structured similar to aspirin. These, like aspirin, have anti-inflammatory properties. And because they inhibit the COX pathway, so hopefully you'll remember that from when we talked about aspirin, but we also will be revisiting that when we go through the MSK module. And then the uses there, like I said, UC and CD. Adverse effects, usually well tolerated, but as expected, common adverse effects, like I was saying before, with everything, GI adverse effects and headache. So nothing too crazy to remember there. Sulfasalazine is interesting because it's a chemical linkage of two medications. You'll notice the first one is a sulfa antibiotic. So this one actually has anti-inflammatory properties and antibacterial properties. Interesting, right? And because of that too, you need to be concerned with patients who have a documented true quote-unquote sulfa allergy. So if a person is allergic to sulfa antibiotics, they have the sulfonamide allergy, then they need to, you need to have caution with this one, and they may not need, should be prescribed it. They may have an anaphylactic reaction with it. So the uses there too, you notice UC, CD again, and then rheumatoid arthritis, which we'll be talking about more in the, the musculoskeletal module, but because of its anti-inflammatory properties, it can help with RA. Adverse effects there. So again, we have the GI adverse effects and headache to worry about. Also on top of that, malaise, just a general, not feeling well, people don't like. And then because of the sulfonamide antibiotic in it, we have to be concerned about those typical adverse effects. And so there's some reminders there for you guys. And like I said, definitely put a star by that, cross sensitivity. If a person has a sulfa allergy, you should be cautious when prescribing this and administering this medication. Olsalazine. So again, it's and this is abbreviation for aspirin. So for all you organic chemistry majors out there, now medicinal chemist is just basically linked to aspirin molecules that are broken down by bacteria in the colon. So this helps anti-inflammatory properties, helps with UC. So here is a summary of all of that stuff. Immunosuppressant agents. So we haven't talked about these too much yet, but and we will talk about these more in the endocrine module, which is coming up. But hydrocortisone and other glucocorticoids, these can help because of anti-inflammatory properties. They can help with UC and CD. They also make an enema of hydrocortisone. So again, because of its anti-inflammatory properties. Quick little note on that. And then there's also anti-tumor necrosis factor therapy. So infliximab is one that can help with Crohn's disease. And then adalimumab, I gotta make sure I slow down to say that one, is another anti-tumor necrosis factor, another monoclonal antibody because it ends in MAB that can also help with Crohn's disease. But this is typically it's typically not first line on that one. So there we have the listing there. And like I said, make sure you go with adverse effects and contraindications, even though they weren't listed on previous slides. Laxatives. So we're changing gears here. So I know everyone wants to talk about opioid abuse, but people don't want to talk about opioids. I was going to say dirty little cousin, but that's unprofessional. No. But anyways, no, all jokes aside, laxative abuse is a real thing. Unfortunately can happen. It usually happens more so with elderly population, people have, or people who have problems going to the bathroom, having regular bowel movements. So that is something to think about, and it is something to kind of have on your radar. And a lot of these laxatives are available over the counter, and so they may not be coming to you and letting you know. But anyways, just something to think about. So all jokes aside, that is a serious thing. It's a real thing. I didn't just put that there as a joke. Contraindications. So unexplained abdominal pain, and then any type of any type of blockage. And this is for all laxatives, contraindication. So here we have them. I like this slide just because it breaks them down by category and everything. Yes, please know the category and which ones are categorized as, which type of laxative. I've had students in the past ask me, can we just know that they're all laxatives? Yes, you can. No, I'm not going to be smart about it. But yeah, yes, I mean, it's important to know that these are all laxatives, but it's also important because of their uses, or there's some, so like the stimulants are maybe better for certain things, and bulk forming are better. So please know them by their category, and hopefully that'll be clear by the end of this presentation as to why. But yeah, so it's annoying. I know, I'm sorry. I know you guys have a lot to study, but please know them by their categories too, because on my test and then on board exams potentially, they will refer to things as it'll be a question about osmotic laxatives, and you have to know which ones they're talking about, or bulk forming laxative, or a stool softener. And so what are you talking about when you say a stool softener? Because sometimes in lay public or non-healthcare professionals, I know in my family definitely, they hear stool softener and they're like, oh, you're talking about like, that's any kind of laxative, and because it softens your stool. And that's true that other laxatives may soften your stool or make you go to the bathroom or whatever, or have a bowel movement. But yeah, so for testing purposes, please keep them separate. Thank you. Bulk forming. So by the title, hopefully you can kind of tell what these do. These basically are like fiber, dietary fiber, or fiber we ingest every day, or we should be ingesting every day. And that basically causes a bulk to go through and form the bowel movement and push its way through. So those are the ones we have there. And that's things like the Metamucil is probably what you guys have seen the commercials for, or familiar with in over-the-counter forms. Next, we have the osmotic laxatives, which these actually work via osmosis. So what does that mean? You guys remember back from biochem again? These pull, so osmosis is the movement of water. So these actually help pull water into the colon, so into the digestive tract. And then because of that extra water, it then helps push everything out, right? So anyway, so these work via osmosis. And then we have some different ones there, so definitely make sure you know the list. Next, we have the balanced polyethylene glycol, PEG for short. And they also have these plus isotonic salt solutions. So make it with or without the isotonic salt solution. These are used for bowel cleansing. So this you may have seen because of family or just from your personal health experience. But if the person has a colonoscopy, they'll be given a big tub of this stuff. No, it's a big jug. Well, they're big jugs we have in the pharmacy of this PEG, and the person's supposed to mix it up with water and drink the whole thing, and then it clears you out. It can be used for constipation, so they will be prescribed too, just for constipation. Not usually your first line, just because it is very, very effective, and it really, really will clean the person out. And they typically, I haven't seen been prescribed just kind of, if someone just needs a little more fiber in their diet, they don't just give them this PEG right away. They usually start with other things, stool softeners, etc. And then it can be used for whole bowel irrigation if the person has unfortunately ingested toxic ingestion, or ingested something that is toxic. So you may see this in the emergency department or an inpatient hospital setting. And so if someone has a toxic ingestion, they may go ahead and give them this bowel cleansing PEG to go ahead and help it excrete the toxic substance that they ingested. And I'll never forget PEG, because there was a lady in Oklahoma when I worked up there who we lived. It was a small town that I was working in, a rural town, so there was no GI specialist or whatever. There's no one to do a colonoscopy in town, so you had to drive at least an hour and a half away to Oklahoma City. So we dispense the medications a lot of times for these bowel preps, these colonoscopies. We'd have these PEG medications we dispense, and you tell them, they go take it on up in Oklahoma or before they go to Oklahoma or whatever. Well, this lady called the pharmacy one day and I pick up and she's like, "This peg tastes horrible. This medication y'all gave me." She's like, "I'm mixing it with Sprite and I'm just sipping on it here. I'm in the car. I'm driving up to Oklahoma City and it's horrible. Is there any way to," and I'm like, wait, you're not supposed to just sip on it like it's soda or whatever. So she was apparently in her car just there sipping on it because it's one of those things where it's like, you're supposed to just drink it all at the same time. And it's one of those that, once it hits, you have to be near a restroom. It's not recommended to just be sipping on it. Like if you're on a bus or if you're driving around your car or whatever. So I always remember, I was like, so please, I was like, you need to get to where you can go to the bathroom and you need to finish drinking it and quit sipping on it. But anyway, so I always have this mental image. Anytime I think a peg of this lady sipping on, and I knew what she looked like. She was in there the day before, and she knew me, of course, right? Extra hilarity when you know the person well. And she was just there sipping on it. So anyways, I always have an image of that. And just so for visual reference, because you guys probably think I'm crazy, but what did I do? But yeah, so this is just what they're big old tubs. So here's the one, the Go Lightly, but it's a pretty big size tub there. So I just measure her trying to, because I'm assuming it'd be hard to drive with this big thing too. So her just having balanced this on her lap, sipping on it, driving up to the colonoscopy up in Oklahoma City. They call it the city, by the way, going up to the city. So anyway, that's enough of those stories. Let me get back to it. All right. So then we have the laxatives again, which we're already talking about. Stimulants. So stimulant laxatives. So these they're basically, they irritate the valve. So that's why they stimulate the valve in a way. And so they irritate it and they cause your bowels to evacuate is the way that polite people say it in polite society. I need to evacuate my bowels, mother and father. Excuse me from the dinner table. No, I don't know what polite people say. Polite company. I'm not a polite person. No. But anyway, so here we have the list there. You guys may be familiar with these, may have seen these before. Aloe vera is really popular with old people. No, I'm picking on old people. I'm sorry. Any old people out there, I'm sorry. But yeah, just in the pharmacy, that's just my own kind of stereotype. But yeah, people like aloe vera juice and stuff. And it works and it's good. And I'm not necessarily against it. It's just laxative abuse is what I'm trying to say. You got to watch out there. I got to be vigilant in the pharmacy. These laxative abuse. It's this unspoken epidemic. I mean, the Surgeon General was talking about the opioid abuse, but no, I'm kidding. But yeah, the aloe vera with the little ladies and stuff. I gotta, make sure they're talking to their providers, right? Go and talk to your PA about, are you using too much aloe vera juice? Maybe you need to have some more fiber in your diet or something else is going on. You need to see your provider. But anyways, so this is the list of those. Make sure you know about those. And last but not least, we have the stool softeners. So we have surfactants and lubricants. So the surfactants, they basically just change the surface of the contents of the bowels. I guess I'm trying to say this without being inappropriate and unprofessional. It just basically makes things more slippery, and the lubricant's the same thing. So both of these soften the environment to allow one to evacuate one's bowels, right? That sounded nice. That was almost poetic, right? Okay, that sounded very professional. But yeah, surfactants, lubricants, they both basically take on point, soften, or hopefully they soften the contents, and then so that there is a easier, less straining, kind of less violent violence. Oh man, I was doing so well. Okay, because normally I giggle throughout this whole thing because I'm an inappropriate, unprofessional person. Apologies all around, but man, I cracked at the end. I'm almost done too, and I think that's what it. Like I knew I was almost done, and I hadn't been giggling and laughing and making diarrhea and jokes and stuff. And so, all right, apologies. Let me take a break, keep breath, compose myself. Okay. And I think too, it's nice that I'm actually not giving this presentation live and in person, because usually someone will make a face or they'll look at me a certain way. And then it's just like, I just have to start. I have verbal diarrhea. Ha 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 ha. Sorry. Hashtag dad joke. Okay. So anyway, so they just, it makes things softer. So the person doesn't have to strain as much, etc. Because of that is a great segue. So let's just slip right into this last slide. Like what I did there. So because I was just mentioning school softeners, that reminded me, please pay attention here to the uses on this table. So the uses weren't listed on the previous slides, but so go ahead and look at these uses here. There were some. I talked about the PEG being used for to colonoscopies and stuff. But go ahead and look through those stool softeners. Like I said, there's some that help prevent straining and help prevent the and so help the process, go smoother, so to speak. So you notice the stool softeners prevent straining during defecation, which can be important. All jokes aside, they can be important depending on if a person just had a procedure or if they're had some trauma or surgery or some other thing that's going on that you actually would want to prescribe, even if they have normal bowel movements and they're having, no issue with constipation. So someone has a procedure in a hospital, you'll see them prescribe this stool softener to help them prevent straining during defecation, just because again, they had hernia surgery or something, I don't know, some kind of surgery where then you don't want the person straining because it may put some stress on their incisions or, their post-operative dressings or something. Excuse me. So anyway, so please look at those uses there. And then adverse effects, please look at those as well. Usually well tolerated for all of them. There are some interesting ones, like the senna can cause some urine discoloration, which people don't like, and it freaks them out. Some can have some electrolyte disturbances, which is interesting. It's not interesting, but that can be serious, and that can be noteworthy, is what I should have said. But anyway, so yeah, make sure you spend some time with this last slide too, and please don't skip over it, because there's at least one student in the past, I felt really bad for her. She's like, I didn't even look at that last slide. I was like, oh, I'm sorry, but there was test questions that came from this last slide. So hint, hint, test questions. No, but yeah, I felt really bad. She was not happy in my office afterwards. She's like, I didn't even look at that last slide. So yeah, please look at this last slide. So anyways, all right. So thank you guys. I think that's it. Yeah, that's it. So thank you guys for your time and attention. As always, I really appreciate everything. And also, if you have any questions, need clarification, feedback, whatever, please feel free to email me. I did it in 2 parts. All right. Look at me now, Mom. Are you proud of me now? No. But yeah, so I did this lecture in 2 parts. I thought it was going to be 3 parts, but 2 parts. So make sure you listen to both parts. Number 1 and number 2. And that's it. So I'll talk to you guys later. Have a good one. Bye.